Welcome to the second Making Data Human Forum brought to you by Cloudsufi. Today we're going to be discussing building an anti-fragile healthcare ecosystem, unpacking data to save lives. I'll be your host, Gina London. I'm a former CNN anchor and correspondent and the CEO and founder of Language of Leadership, which works with multinationals around the world to help their executives connect and engage better with their employees and their customers. So let's talk to some executives who are also working to connect and improve the lives of patients through healthcare around the world through our panelists. Our panelists that will be joining us in just a moment include Irfan Khan. He's the CEO and president of Cloudsufi, and he serves on its board of directors. He's responsible for building Cloudsufi into a powerful organization focused on eliminating the gap between human intuition and data-backed decisions. Before joining Cloudsufi, Irfan was the CEO and president of Bristlecone and was responsible for the record turnaround of the company over 60 months to a world-renowned supply chain brand. Chitra Nawbatt is the global head of health assurance and innovation at General Catalyst. Chitra has multi-industry and multidisciplinary expertise in areas such as finance, risk management, product development, and go-to-market and growth strategy. She was also a business TV journalist for Reuters and other media platforms. Through her work as a business storyteller, it led her to collaborate with leaders and enterprises to build and innovate. Chitra's work at General Catalyst focuses on health assurance, empowering founders and companies in both the private and public markets to accelerate the transformation of the healthcare industry, from a sick care system to a resilient, proactive health assurance system designed to help people stay well, bend the cost curve, and make quality care more affordable and accessible to all. Dr. Marketa Wills is our next panelist, and she earned her medical degree from the University of Pennsylvania School of Medicine and completed a residency in adult psychiatry at Harvard's Massachusetts General Hospital McLean Hospital program, serving as chief resident in her last year. With her expertise in driving value-based member-centered care and managed healthcare programs across broad organizations, her deep understanding of the clinical aspects of the healthcare delivery system, her experience with government-sponsored healthcare, and her sharp analytical, financial, and business acumen, Johns Hopkins Healthcare decided to name Dr. Wills as their Chief Medical Officer in 2020. And rounding out our panel today, Dr. Ravi Starzl. He specializes in the computational analysis and modeling of complex information-driven systems, with experience in such diverse domains as biotechnology, financial systems, and internet topologies. Dr. Starzl is active in the entrepreneurial space, and he serves as the CEO of Biopix, a company specializing in solving what Dr. Richard Haas of the Council of Foreign Relations called our next big issue, antibiotic-resistant bacteria. In addition, Dr. Starzl founded Firebreak, a company focused on developing antibody over-the-counter solutions to solve the world's biggest health crisis. Dr. Starzl comes from a long lineage of problem solvers, including his grandfather, Thomas Starzl, who did the first ever liver transplant, and his father, Tim Starzl, who helped develop a Gates Award-winning pediatric solution that helped bring an end to the pediatric diarrhea epidemic in India. Thank you all for being our panelists. Now, today we're going to be talking about building an anti-fragile healthcare ecosystem, unpacking data to save lives. And we're going to kick off with our panel discussion. What are the biggest problems for everyone? I'd like to hear from each of you now. What are the biggest problems that the healthcare system is facing today? And how does data play a role in solving these challenges? I'll start with you, Irfan.
Thank you, Gina. And first of all, I feel really humbled by sitting with people who are intellectually 10 times better than me. So I'd love to hear what they say. But let me give you my perspective. I mean, if you look at, there's a point of view on the global health system, and there's a point of view from US. Let's talk about US, right? One of the most matured healthcare system, but super expensive because most of the component which moves the system is very manual and very primitive, right? And that loads the cost, and that affects a lot of people who can leverage the system, right? The other piece, which is which is worrisome, is the supply chain. The backbone is unresponsive, and the only reason why it's unresponsive, it's never been fixed. It's been in silos, and and we saw it the moment there's a black swan event like COVID, which happened in the last 24 months. You see the weakness coming out. There's a shortage of everything, from the masks to the vaccines right now. Manufacturing is never an issue here. It's a question of the supply chain distribution of planning and execution, which kind of breaks the system right now. It becomes much more transparent. The third one, which I see from an eye of a practitioner on data, is the data is there, but data is sitting in silos, and sometimes it's not even structured. So we are not able to triangulate the data, which is required to make sure we are able to connect the dots and make some big impact in human lives in terms of innovation, of changing and saving them right now. The thing which a lot of people miss out is the physician fatigue, right? We all focus towards the people who need the medicines and need the care, but the providers, the physician fatigue is huge. And the reason is they're not really equipped with technology and data to really perform. It's like a quarterback running on the field with no insights coming in, what tools he needs at this point of time, which is very tough. We are seeing some pieces of technology coming in. We're looking at, we're looking at telehealth, we're looking at telemedicine, advanced electronic health record, patient portals, mobile apps, all the work, but still in the infancy of maturity, I would say. Last but not the least, I would say, is the clinical trial, which a few of the people in the panel would be involved. It's a multi-year program. The world has been reduced to 6 to 12 months now. Nobody has really time to wait for a decade to create innovation. And that's where I think we can use a lot more technology and a lot of data and a lot of AI to really compress it. And we saw fragments of it in COVID. So these are a few of the things which we observe when we are trying to solve problems. Back to you, Gina.
Thanks for that, Irfan. We talked about physician fatigue and silos and the AI element. Maybe that would be an opportunity to bring in Ravi then, with your background in artificial intelligence, what you see the data's opportunity is here.
Thank you. I completely agree with Irfan in his assessment. I would say that you could almost break down these challenges by the dimension that they play in. One of the great challenges to the siloed data is the legal framework of the HIPAA regulations, and many of the organizations around the world have found that they can correctly and effectively leverage their silos of data, especially large healthcare systems, to develop advantageous reimbursement business practices. And so this gives them a competitive advantage in their own data that they have a vested interest in not sharing with others. This impairs and inhibits transparency, and this certainly has a direct impact on cost controls and on fluidity of information that could be used to make better decisions. Artificial intelligence is many things, but one thing it is not clairvoyant. It will make decisions based on historical experience. And if your historical experience is siloed away from other historical experiences, then you're very likely to end up with a fragile system or an overfit system, which will not perform as well in the real world. Second layer that I think could really be improved upon is actual personalized medicine. And that takes on many different dimensions, from getting people more vested in their own healthcare to getting physicians to be more responsive to the specific conditions of each person. Medicine has gradually become more of an actuarial practice, where you're just looking for statistical edges over large numbers of people. And the problem with this is that it actually underserves each individual's outcomes. And so using AI to leverage personalized medicine that also has an actuarially fair premium could be a great area of expansion. Back to you.
Thanks for that, Dr. Starzl. And over to you then, Dr. Wills, with your perspective in the world of medicine at Johns Hopkins, in terms of the personalized care and the other things that you're seeing that data can impact in terms of advancing healthcare.
Thank you for the opportunity to be on such an illustrious panel. One of the things that comes to mind for me with regards to strengthening our healthcare system is access and affordability. And so when we think about how to allow and use data, financial data, clinical data, AI, to think about how do we bring healthcare in the United States to more people. How do we allow for payment mechanisms to stabilize folks in the community as opposed to in higher levels of care that are more cost intensive? And how do we engage patients in their own health? And there's so many opportunities to be able to do that using data, using digital tools to support self-management. And so as we get more and more intelligent and smart about the clinical aspects, I think those are ways in which data can help us lead to improved health outcomes for all. I think also one other thing that I'd love to lob into the conversation is the equity piece, making sure that we are taking a good look at data across all aspects of someone's existence and identity, and closing gaps in care for those who have been medically underserved. So those are ways I think data can enrich the lives of people from a healthcare outcome. And I'm excited to see many of the opportunities unfold here in the future. Back to you, Gina.
Thanks for that, Marketa. When you talk about the equity of it, and as Dr. Starzl was talking about, the personalized, I mean, those two have to come in together, don't they? And Chitra, you've got such a multidisciplinary approach to your practice and understanding of data connected to healthcare. Weigh in on all the different things we're seeing together. I'm going to challenge you to knit them all together.
Well, actually, you know what? We're all in such agreement so far, based on all the comments that have been said by Irfan, Ravi, and Marketa, and and I agree. And I would also kind of add to the access piece that Dr. Willis just talked about is serving individual populations, persona-based and personalized. And I think the pandemic really brought to life the significant gap there, inconsistencies, fragmentation, and part of the barrier is data. Core data, actionable insights, information, it's trapped in artificial, human-made, or analog boundaries. And in talking to healthcare systems and clinicians, what we find is they say that data entry piece has become so time-consuming, it significantly takes away from the clinician's ability to spend time with the patient and offer actual care. And so there's a big opportunity for data to be more accessible, easily more consumable, holistic on a patient, portable, user-friendly. Data should be an enabler to that personalized care decision-making at scale, whether it's in person or virtual. And the opportunity is to have efficient technology infrastructure that gets at that trapped data and legacy systems or legacy spaghetti systems to facilitate a data sandbox, if you will, that can then feed persona-based care workflows and processes at scale.
Well, and Chitra, when you just touched on the idea that the data shouldn't be a barrier, it should be an accessibility measure, that leads me right into the next question. And again, to Irfan, of course, as the CEO of Cloudsufi, you know that this topic today is all the anti-fragility of the system as an ecosystem. So talk a little bit about that concept, and maybe providing more accessibility would be one way to make it less fragile, but I'd like you to explain that concept in this context.
Sure, Gina. If you look at all three of my panelists, what they said, I mean, we had Chitra, who's of course giving opportunities for companies to disrupt by funding them and giving them the oxygen. And then we have the two doctors who are spending time either building ecosystem on healthcare or innovating it right now. The common theme today is how do you make sure healthcare as a system become anti-fragile? And the reason I use the word anti-fragile, I've been using it with my last company too, because it is a word which I've borrowed from Nassim Taleb's book, which is Anti-Fragile, Things That Gain from Disorder. It's beautiful. The concept is so beautiful, could be used for anything. Saying wherever there's a black swan event or the disruption, we should have systems and processes and data aligned to really thrive on that. It's not about being resilient. It's not about being super strong. It's about, can I thrive at it? And when you have created an ecosystem like that, then in a very strange way, you want that disruption to happen, because that's when you thrive. And the only way you're going to do it is in multiple scenarios right now. If you look at clinical trials, if you look at the way the data has been read or the practitioners who are using the data. There's a whole big gap at this point of time where we have data, we're sitting in silos, and on top of that, this is only structured data. The whole unstructured world is completely missing, and there is still mechanism, and I'm sure, Chitra, you would be funding tons of these companies like that, which can actually bring that whole, I would say, the gold into the mix to make sure that then you start making sense of everything. Today, we are running on a path where structured data decides our decision making. And unless we make the system anti-fragile to make sure that we are able to capture all the unstructured data coming in because of disruption and mix it into a diagnosis, that's going to be help. And at Cloudsufi, it's very simple for us. The vision is, and the more and more we meet customers and build a product, it becomes more clearer. We want to reduce the gap between human intuitions and data-backed decisions. And if you look at your personal lives, and there are times where all of us had somebody very close to us in the hospital or being cured, there is such a big gap between what my gut tells me and what the data says. And every doctor which touches it or every practitioner which touches it has a very different interpretation. And it sometimes saves lives. Unfortunately, sometimes it does not. So that's, to me, making the concept of anti-fragility into the healthcare is super important.
And picking up on that theme, then I'm opening it up to the other three panelists. When you hear anti-fragility or helping make sure the system in healthcare is less fragile, what stands out to you then as the first go-to? I'll start with you this time, Dr. Will.
So for me, as a physician clinician and also physician executive, I always think about the patient and putting that patient right at the center. And so all these forces that Irfan describes ultimately are used to lift individuals up and allow them to lead healthier lives. And so the extent to which we're able to weave together the different data that's sitting in silos, bring that and leverage insights from the data in ways that will drive towards healthier patient outcomes. That's what comes to mind for me. And I really like that concept of anti-fragility in this context to help improve patient lives.
Thanks. Chitra?
So it's there's a lot of things that Irfan talked about and Dr. Wills just now, and in terms of when you think about the patient, I think we have touched a little bit upon it earlier, right? Which is this notion of holistic patient health portable. To compare and contrast, in one of our portfolio companies, Tendo, its CEO talks about this, which is when you think about financial health, right? You can get your credit report, you can go to a place, and you may not agree with all of the results in the credit report, you may not like it, but you can see your holistic financial health. The question is for the patient, where do they go to see their holistic patient health? And that data being accessible, that data being portable, that data being such that you as a patient, you're not beholden or held captive to any particular doctor or healthcare system. You can go wherever in the country to get the best care possible for you. And it goes back to data. And one of the things Irfan talked about, which we're working on and we're working on through our portfolio companies, is creating those efficient technology platforms, software processes, infrastructure mechanisms to access that data through, for example, one of our companies, Commure. And that's what it does, which is it has the ability to access data from these disparate systems, harmonize, standardize, aggregate the data, provide a facility, a utility, if you will, where it's usable, easy, with good user interface, workflows to enable that care personalized at scale.
That's fantastic. And again, breaking down those silos, getting that personalized care, and again, making it accessible. Thanks for that, Chitra. And it's great to hear that there are active organizations that are looking at this right now, and in addition to Cloudsufi and the ones that you're supporting. Dr. Starzl, I'd like you to chime in on that, but I'd also like you to then give us a little maybe deeper dive on, as a systems scientist, you've been examining the healthcare system's response to the pandemic and how the data may or may not have been applied as quickly or as readily as you might have liked, or might have, what your your analyzation is then around how the data has been involved in the response to the pandemic, and connecting it then to the idea of anti-fragility.
Thank you. So fragility in my mind is highly connected to the concept of overfitting or which is really just a technical way of saying the intelligent data systems are going to make decisions that are actually wrong or suboptimal in some way, because then it thinks it's right, but it's actually wrong. And one of the ways that this happens is that the parameters or the specific kind of data that you're looking at to try to make decisions is not highly correlated or connected to the outcomes that you're trying to craft. And so generally speaking, one of the ways that this is solved is by going back to asking a better question. And in the current paradigm of data driving all, there's actually an inside joke in many machine learning circles, which is that if you have enough data, you don't need to know anything because the data will just speak to you. This is actually incorrect. It's a joke because it's actually an incorrect concept. You really do need to be asking a good question in order for the data to be meaningful in any way. Because
the data for the sake of data isn't going to give you an answer if you don't have the right question, perhaps, or a narrowly defined, as you said, desire of an outcome.
Correct. So the concept of anti-fragility in my mind is highly connected to making sure that we're actually trying to craft the correct outcomes and then have associated the correct correlating parameters with that actually vary in some kind of meaningful way, in a dependent way with that outcome. And so making sure that that's actually crafted in is a huge part of the puzzle and sometimes under observed as a concept. Now, that's actually, please go ahead.
No, please. I was going to say this. Actually, I was going to interject and maybe build on what you're starting to say already. Is that the whole idea of how data is evolving and getting those questions right? Your grandfather Thomas Starzl did the first liver transplant, and your father is also an innovator. So, as you're one of those, that legacy of innovation, how do you see it evolving already, and what more needs to be done? And maybe you're already touching on that a bit.
Certainly, and I think that the data pipeline can drive two different kinds of innovation. Number one, it can drive the kind of innovation that Dr. Wills was discussing, which is finding ways to empower people with their own data and bring them into the healthcare system so that they can live stronger, healthier lives and generally be a more functional and happy part of the world that we live in. That's a huge part of the puzzle, and we're not necessarily going to mine the data using our preconceived notions of what the right answer is very effectively. We're going to have to ask the questions of those people. What would work better for you? What is the lifestyle that you're actually trying to engage in? What's the pattern of care that you can actually keep up with? And then we can factor those things into these anti-fragile systems, and they'll become far more robust. The other pipeline that I think would really benefit, and that has demonstrably made substantial contributions recently, is in the innovation domain. And so that data, the patient experiences, the outcomes, the both positive and negative outcomes, such as say hospital-acquired infections or those types of things, can very powerfully drive innovation in new therapy development. For example, in the case of the pandemic, as you were referring to earlier, what's become quite clear through analyzing the genetic structure of the COVID virus and looking at its progressive mutations over time is that the virus actually evolves in a somewhat systematic way. And the evolution of the virus, particularly with these lethal variants that are emerging at a high rate, can be somewhat predicted. And that level of prediction can enable companies to get out ahead of the problem. The current analysis thinks that, for example, the double mutants in India may reduce vaccine efficacy down to something in the neighborhood of 60%. That's a big problem for all of us since we just went through this massive effort to get everyone vaccinated. If we can figure that out faster, and if we can gather that data from the world, from the wild, in a more efficient fashion and pipe it directly to the pipelines where understanding the future evolution of these structures can make a difference, then we can stay ahead of the problem instead of constantly playing catch up.
And is data cooperation, or is there data competition now that is becoming a bit of a problem? I'm going to serve that over to Dr. Wills along the idea of what that is happening then with your experience in that area with Johns Hopkins and some of the areas that you're working on to try to advance the data there.
So less with regard specifically to Johns Hopkins and more broadly thinking about just value-based care. I think about measurement of outcomes and quality. And that measurement of quality and being able to say, compare, as opposed to paying for visits, we are paying for positive health outcomes. And so that value-based care, in order to be able to finance it in that way, we've got to be able to monitor for each individual patient what's better. What does better look like for you? How do we know that you're healthier? And so the measurement piece of data is really important to be able to understand for each individual. How do we know that their hemoglobin A1C is reduced? How do we get at that granular level for everyone to be able to pay for value, pay for health improvement, as opposed to only paying for the widgets, if you will. So those are some of the things that run through my mind with regards to data. How do we make it actionable at the individual patient level so that we can then make sure that we're incenting in the proper way our forces, our economic forces, to be able to drive towards positive health outcomes.
Thanks for that, Dr. Wills. It's important to think about those positive patient outcomes. And Chitra, as you've got an exciting portfolio, as I touched on, of companies that you're working with, and you're looking at patient monitoring as well as the several companies you're providing those enterprise solutions, what are some of the things that you're excited about as you look to the future of healthcare?
Well, and there's just a couple things I'll touch on that, but I wanted to go back to something that Dr. Starzl said,
Please.
which I think is really important, because he talked about, the pandemic and artificial intelligence and data, and a big part of that, and what we believe the general catalyst is around radical collaboration. Because even if you have access to the data and you've got user interfaces, but what's important is breaking down the boundaries, breaking down the silos, and having radical collaboration. If we're so long in the pandemic, but if we all recall, in the end of 2019, when the pandemic first started happening, some kind of viewed it, oh, there's this thing happening in China. Then it went to Europe, right? Italy and the United Kingdom and France. And I remember having a very early conversation with the ambassador to France in the United States about this lack of flexibility or lack of speed to sharing data. Now, of course, you've got data privacy and things like that, but the opportunity is to break down the boundaries, anonymize the data, look at what's happening around populations, because it wasn't just only about what's happening in China, England, France. The reality is it's people, and it's going to affect people all over the world, boundaryless. Let's look at then a broader population upon which you run algorithms, and that's where you get better outcomes through the AI, through the machine learning, better predictive outcomes to then make decisions around what's happening, what is this COVID strain, decisions around the vaccine, decisions around after effects of the vaccine, but it's being able to run algorithms over larger sets of data. And how do you accomplish that? It's through collaboration, whether it's within a country or across countries, in an appropriate way, respecting data privacy and things like that. So I just wanted to flag that, because I think that's an important piece here. And for us, in terms of what we're seeing across our companies, it's not even so much about our individual companies, but for us, it's about the network effect. When you bring together our companies in a powerful way and you look at integrated solutions.
That's great. And I appreciate the combination of the collaboration call and the radical collaboration call, as well as what are some of the things that can be done in this network that you're working together to help for the future. And over now, back to you, Dr. Starzl, because you were talking earlier about the variants. And then, of course, there's a great deal of concern about that, but there seems to be a little bit of a comfort in the United States and other countries as they appear to be coming out of the pandemic. But what do you see as that current global landscape and the data? Maybe there's still a need for more collaboration as you see, how are we utilizing what we know so far and what we can be applying in the future to help bring this pandemic clearly to an end, or is it clear?
Well, I'm an enthusiastic supporter. Consider me on the bandwagon of radical collaboration, because it clearly is the way that we're going to solve most of the hard problems in the future through this cross-disciplinary, cross-data mining process, but also not just mining with pre-hashed questions, but also asking new questions. Sometimes the best way to solve a problem is not simply deploying a tool that's already in your toolbox, but actually thinking of a new tool or discovering a new tool that's actually hasn't been deployed before. One example of that is the project that I'm working on, which is Firebreak, where we've taken a look at the genetic structure of the virus and we've looked at its mutation patterns. And we've developed a novel antibody platform technology in Firebreak, which allows us to proactively anticipate the variants and develop essentially an orally administered antibody that is very inexpensive, plentiful, and safe, and highly potent at neutralizing all known variants. And this is already getting ready to be deployed in multiple countries around the world. So sometimes a synergistic outcome is the best outcome. You know, if you have a vaccine, you're protected on the inside of your body. The next logical question would be, how do you protect on the outside of your body? For example, at the point of infection, is there data lying around in these vast silos and repositories that's low-hanging fruit for a very easy, novel way of approaching that adds to the cumulative level of protection that you can obtain? And so to that end, I would say that there's no limit to the value or to the potential ways in which data can be used properly. As far as the pandemic goes, I think it's a very complicated and difficult situation, which doesn't really have an end in sight. Unfortunately, Brazil, India, and other hotspots around the world are breeding variants faster than we can even identify them. And every one of those variants reduces vaccine efficacy and reduces our existing armamentarium's ability to deal with it. I don't think we're going to get out of this problem, meaning the global pandemic, without radical collaboration. And our best outcome would be to try to get a handle on it so that the endemic, and it is clearly an endemic disease now, so that we can get a handle on the endemic nature of it and have an annual care cycle that proactively gets the most vulnerable and susceptible people the tools they need to protect themselves before they actually get critically ill and become disabled.
Thanks for that. And speaking of tools and thinking about the pandemic and how to potentially find a collaborative measure to combat it, over to you, Dr. Wills. Is there, or something beyond the pandemic, is there a specific improvement around healthcare or the pandemic that you're particularly excited about that you can see on the horizon?
Well, one silver lining for me as a psychiatrist of the pandemic, Chitra touched on this a little bit earlier, is I think it made behavioral health and mental health issues so much more accessible to people. I think before there was such a stigma about behavioral health and mental health issues, but because of the pandemic, people began to relate. There were statistics such as 30% of Americans were having symptoms of depression and anxiety increased over normal at the early phases of the pandemic due to all the uncertainty. So the fact, I'm looking forward to leveraging that insight and that awareness in ways of integrating behavioral health and physical health. So I'm really excited about those opportunities that are on the horizon for the healthcare system. I think it's become a lot more easy for people to say, hey, I just had a great session with my therapist. And that's become more acceptable. And I'm really glad that we're thinking about how to integrate physical health and mental health.
And along the same lines, when you're talking about the accelerated awareness, accelerated acceptance, accelerated integration, maybe none over to you, Chitra. Are you seeing some of this radical collaboration? Is there, because of the pandemic, a strange silver lining again, is there an acceleration to accept and embrace that form of collaboration to improve healthcare that you're seeing as well?
Most definitely.
Or what are you excited? Blue sky as well.
Well, a couple of things there, and most definitely, and you know, Dr. Will said this earlier, access, affordability, and the other piece we'll add to that is assurance, right? So, you know, we're talking about access for people everywhere, scale, reducing cost, and assurance is improving patient outcomes, and they're being valued. That value is created not from keeping people sick or people having to pay high healthcare costs, but value being created from health assurance. And there's a different orientation. You know, we're having some very meaningful conversations and collaborations with some of the large healthcare systems who are now more open to being platforms to co-opt this level of digital innovation to achieve that scale, to achieve higher patient service and care levels. And, you know, Dr. Wells talked about behavioral health, and I mentioned it earlier with our company, one of our portfolio companies, Athelis. And what's interesting is what they set out to do with remote patient monitoring. They ended up discovering a significant opportunity to help within a particular type of chronic illness within mental health. And the specific example is for some types of, for patients to qualify for certain kinds of drugs, they've got to do, prick the finger and do a blood test. Well, that's a lot of effort if you've got to have the patient come into the doctor's office episodically, get them to schedule and come in. One of the things that we've done through technology and providing this remote patient monitoring for doctors is the blood kit is sent out. The patient pricks their finger, that data is sent back to the doctor. The doctor then determines if, hey, you know what, this drug can help this person deal with this particular mental health issue. And you're being able to dispense that real time, more active as a mechanism to help behavioral health, which has become just so exacerbated because of the pandemic. So just a real time example there, touching back on the mental health and the behavioral health piece. But in terms of how technology, efficiency within the supply chain, if you will, can deliver ongoing care, improved care, and at reduced cost.
Thank you so much for that. And of course, Irfan, we need to bring you back in as CEO of Cloudsufi, which is using data to transform the healthcare system. What are you excited about some of the innovations that your organization is implementing?
Absolutely, Gina. But I want to make a comment. There was some very interesting dialogue which was going on in the panel. And if you look at the piece I want to bring in also along with this is, if you actually look at today's healthcare system across the world, right? Not where we are, which is like 3 times more expensive than everywhere else. I think if you look at the real life of humans, when are they going, and that's where we are, and I'll talk about innovation there right now. When you're going and looking at your dad or mom or brother and sister in a hospital or a care facility or anywhere else, you get to see the doctor for like maybe a few minutes, and the doctor gets to see your patient for not more than 10 minutes, if he's a really good doctor. It's not their fault, but it's like a machine. They have to do it right now. At that point of time, the diagnosis is based on some charts and what the patient tells you right there and then. And he has no idea about what happened to the lifestyle of the patient over the last 24, 48, 52 hours. He has no idea how the people who are close to the caregivers or people who are around the patient have observed his behavior. He looks at a point diagnosis and point problem, and he does the best he can with the limited tools he has. So if you look at what Chitra, you mentioned about collaboration, bringing different technologies together, right? I love the fact that today, and I think Dr. Wells, you brought it up, saying that is there a way people are not scared about talking things which people were originally was a taboo? I'm not going to talk. Yeah. Depression is not a good thing, right? Or or there's so many things which was more of a taboo. The third one is, okay, how do we take it more preventive? It's all right now descriptive. Everything is, I go to a doctor when I have a problem. I never go to a doctor to say, how can I be healthy? Rare, okay? So from our perspective, when I look at all these pieces, we are trying to fill in that holy grail in, it's a product services play, right? We have a whole services division, which is focused on understanding the customers. And the only way we can get those beautiful ideas into our R&D labs is when we're solving the problem. And that may not be providing a product, but services to it right now, right? It could be AI-based diagnosis and imaging. We're talking about disease management, AI-based or supportive drug discovery. We are deeper talking about therapeutics in terms of, especially around EDRs, patient portals, pharma supply chain, which is again, a huge area. How do you make sure that medicine reaches at the right time at the right place to do it, and the optimal one. But on the product side, we Sufi Brain, which is a platform which is getting built for the last 24 months right now, is coming live. And there are different applications like Sufi Docs, which is fundamentally, it enables AI-based reading of clinical notes and converting them to structured data, and also capturing unstructured data for better patient outcome. So these are areas where we are working on. And the whole purpose there is, again, our tagline is pretty cool. We say we make the enterprise data dance, but actually, if you look at, we are just focused on reducing the gap. I don't want to be in a hospital thinking about my dad and mom. My gut tells me something else, and the doctor's telling me something else. and I'm kicking myself for the rest of my life that I should have actually followed my gut, right? And it happens to a lot of people. Now take that and further take it to a non so educated countries or a second world or third world countries right now. It's worse because most of the time the patient doesn't even know how to articulate to the doctor. And the worst is now you take it back to the first world country, which is my biggest frustration, where a doctor comes and asks you saying, what do you think? What kind of, these are three options. What do you think we should do? And you're staring at him saying, like, I'm not the doctor. Why are you asking me to choose on something which I have no idea about it? So that kind of, the reason it's happening is because the doctors don't have, the practitioners don't have the entire tool to be so confident to say, you know what, uh, uh, Gina, three options, this is the option I want you to go for, right? I think that to change that entire communication is a long process. The whole anti-fragility fits in right now, the product we're bringing right now, so that people are able to really not be more forceful on what they would like to, in a good way, what they would like to suggest as a cure versus asking a poor patient or their family who has no idea about medicines saying, what do you think we should do? So that's where the focus on from our perspective is, Gina.
Thank you for that, Irfan. I mean, so much compelling conversation. We could continue for hours and still be at the tip of the iceberg, I think, in terms of the holistic approach to the integration, the collaboration, putting the patient and that all those integrated pieces in the forefront. Thank you so much, each of you, for this. I'm going to ask each of you, I'll start with you, Chitra, then Dr. Starzl, Dr. Wills, and leave the final closing thoughts to Irfan. But give us your final thoughts on how we help make the healthcare system anti-fragile. Chitra.
Well, one of the things that's been gratifying being a part of this conversation with these esteemed panelists is this notion of radical collaboration and responsible innovation, which is what we're about at General Catalyst. So, the short answer is I'd love to find ways to collaborate with each of my esteemed panelists, on this journey to providing health assurance and to helping to reduce the cost of care and to doing so at scale.
Dr. Starzl.
I would say that just echo those same exact thoughts. And I would say, let's not forget about the rest of the world. Healthcare has become a global enterprise, as we can see from current events. You can't get away from problems that are global in nature just by locking down and isolating yourself. So we really do need to extend those layers of collaboration into every corner of the world as aggressively as possible. And I think anti-fragility in the healthcare system is long overdue. So I'm enthusiastically on board with what Cloudsufi is trying to get done.
Dr. Wills.
Yes, definitely support the comments of my esteemed panelists. I think one other thing that I would want to just add is also thinking about, we touched on it, but the social determinants of health as well. We've got to think about food insecurity, about transportation insecurity, about all of those things, basic needs that everyone needs to get taken care of before they can think about purchasing their medications. And so making sure that as we think about healthcare solutions using data and technology, that we address some of the social determinants of health as well.
And final thoughts to you, Irfan.
Great. I think I concur with all of them. In fact, if you look at what strikes me, we are a single unit. It's not country specific. This is one industry which cuts across every human in every country. So we cannot be isolating as far as US. So I think failure is not an option in the healthcare from my perspective, the way I see it. Lots and lots and lots of data is there, but they're not being used effectively. So there's a whole lot of work for companies like ours and the companies like, Chitra, what the whole your team is incubating right now. Practitioners to me need to be equipped with both structured and unstructured data. And again, we all have seen it, we all have struggled, and it'll become more and more definitely needs to be done right now. I think sharing of data is again a key area. I think some of the panelists alluded to that. And think about a world where we can, the patient, we all are we have a whole bunch of data on our own world. If we can start, if we're allowed to share in a very secured manner our experiences are structured and unstructured data. And I keep stressing on unstructured, which is equally important to really solve bigger groundbreaking problem, bigger analysis, bigger testings right now to do it. I think we'll really compress the time and bring a lot more dimension, which is needed as Dr. Dr. Ravi, you mentioned that, we need to look at outside. Right now, we all focus now inside. In fact, I was listening to you and I was thinking, I think we should incubate a few more ideas saying, okay, what do we do in terms of not getting the disease versus curing the disease right now? That's important for us to do it. And the last but not the least, this Black Swan event, which happened in the last 24 months, kind of gave another dimension that healthcare is the industry, or healthcare is a very high target to even make or break a country. It was never seen like that. There was time where the warfare was, okay, we threw the missiles on each other. Then there was a warfare of, okay, let's go after the software, right? This is most lethal than anyone else right now, because you incubate a problem and it ripples it, and right, it kills the really soul of the entire country, right? And I think it's a very, very strategic tool for us to be very strong. And we're fortunate to be a part of the world where all this innovation is happening. But as Dr. Ravi, you said that we should extend it across the board and take data from everywhere else right now. So for us, it's the Cloudsufi was founded in this Black Swan event, and we grew like crazy, nearly 800% year on year. And we are looking, saying, how can we tomorrow, if we have an employee or somebody who comes and tells us saying, you know what, because of what you did, because of the tool you made, I really could save my dad, or I can save my mom, or I save my child, or I save my neighbor. And it was not the medicine, it was that one little information which I provided to the doctor, which he didn't have it. And I've seen in my personal life, I've lost both my parents in hospitals, and I've seen and we had a doctor as a part of the family, and I could see the frustration of how do I make the structured and unstructured data and give the same message across the supply chain of health right now. So there's a lot of work to be done, and I'm sure what I heard in this panel, I think help is already on the way. So thanks for doing it.
Thank you, Irfan. This personal and professional discussion and this commitment of collaboration has been certainly compelling to me, as I've been privileged to listen to each of you, and I know for our audience today as well. Thank you so much about thinking about what's happening, what's the call for breaking down the barriers to provide more accessibility in an integrated way, to ask the right questions, to find the innovations, and to make those radical collaborations that help lessen the fragility of healthcare today. Chitra Nawbatt, Dr. Marketa Wills, Dr. Ravi Starzl, and of course, the CEO of Cloudsufi, Irfan Khan, thank you for a most captivating and robust panel discussion.